Hello, I'm Dr. Jim Haase. Today I would like to discuss temporomandibular joint disorders. The temporomandibular joint is formed by the mandible and the temporal bone just in front of our ear. The main symptoms that occur during temporomandibular joint disorder are pain that is localized either over the joint itself or in the temporal bone or felt in the ear. There may be abnormal sounds on movement of the jaw, like popping, clicking, or cracking sounds. There also may be restriction of movement on the ability to open the jaw fully or to deviate the jaw laterally, sideways at all. The most common cause of temporomandibular joint disorder is trauma caused by either a direct blow to the joint itself or a direct blow to the mandible. It can also occur after car accidents due to whiplash, where the head is jerked violently and it can put a lot of stress on the muscles and ligaments of the joint. Temporomandibular joint disorders can also occur due to poor dentition, where there's abnormal bite problems with the teeth, the alignment. There may be a high filling, and it's putting too much strain on the muscles, causing them to overwork. This can occur either on one side or both sides. It varies in people. And the reason that people don't recognize is sometimes they just have no clicking or cracking or restricted motion, but just feel pain in and around the temporal area, and so think it's a headache that may be due to something else. So if you're experiencing any headaches or restriction of motion in your ability to move your jaw, it's very important that you have the TM joint assessed. Another cause of temporomandibular joint disorders can be due to an excessive amount of psychological stress, and the person's reaction to that stress is to want to either clench their teeth for a prolonged period of time or to grind their teeth together. And this most noticeably happens at night while they're sleeping. This causes an excessive amount of stress on the muscles, continually working for a long period of time, so they become very tense and become inflamed and tender. So it's important that a person in this situation should be able to learn stress management and how to cope with stress so that it doesn't result in this grinding and clenching effect. Also, people with this problem often will need a bite plate at night to prevent their teeth grinding together, because it also wears down the surface of your teeth, and your dentist will look for this problem if you are complaining of some pain in the joint or dysfunction in the joint. So for any of you that are suffering from headaches and pain in this area, you should have this problem corrected. Sometimes the problem can also be due to degenerative arthritis in the joints, where the cartilage in the joint is starting to wear down, just like it could in other joints of the body. And if it gets severe enough, sometimes it requires surgery, but that's fairly rare. Most of the time there is no joint damage in there, and it's strictly a problem with a muscular imbalance where there's too much tension on one side versus the other. And this can be corrected through soft tissue therapy, giving the person corrective exercises, massage therapy, various forms of soft tissue therapy can be used, and stress reduction. So please make sure that you address these issues if you are having a type of problem like this.